Everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And we're here at the HIMSS 2022 conference, and we're here with Pouria Sanae. He's co-founder and CEO at ixlayer. Welcome, Pouria.
Thank you so much, John. Great to be here.
Yeah, so tell us a little bit about yourself and really the background of ixlayer.
My background is within the healthcare IT space. ixlayer started back in 2018, early 2018, and the concept of ixlayer came from me working at a larger sequencing lab, seeing how large health system, Mayo, Geisinger, Mount Sinai, Semaphore, and Vitae, reinventing the same wheel over and over again. And it was very clear to me that, hey, there is a missing layer on top of the clinical lab, and the I and the X in ixlayer stand for infrastructure and patient experience layer.
Interesting.
And that's sort of where the idea came out. We started at 2018. We started our first lab test was remote lab testing for Alzheimer's patients, and then expanded to newborn screening, pharmacogenomics, and then everything else after that.
Yeah, so tell us more about what is the problem that you solved. What was that layer, excuse the pun, what was the layer that was missing that you guys are really solving for organizations?
Yeah, so when it comes to diagnostic testing, there is a need for remote lab testing. There is a need to meet the patient wherever they are, bring the lab testing to them. And to do that, you need to have quite a complex technology layer connected with an ecosystem of services, labs in multiple state, physician networks, mobile phlebotomy, kitting and fulfillment, insurance eligibility, and so on. And wrap this around with a patient experience flow, so they go through a journey that is easy for a patient, they go through a journey that can provide them a result back so that they understand, and that can offer them a continuity of care. And we provide that in a package, and we provide that under a brand of our consumers, under a brand of large biopharma companies that are doing the decentralized clinical trials, by payers that are doing gaps in care program, or even consumer retailers that are launching direct-to-consumer lab tests. We're not visible anywhere. We're the SaaS platform that powers them.
Interesting. So is that the main target for your product? Is the ones you just mentioned, or do you provide organizations to it? Like, who is the target for this product?
Yeah, it's four different key sectors that I mentioned. It's biopharma, it's payers, it's providers, population health programs, and it's consumer retail, direct-to-consumer health testing.
Okay. Interesting. And as you described it, I thought, is this really a COVID-inspired problem that you're solving, or was this problem always been there?
No, this problem has always been there. We started this thing back in 2018.
Okay.
There are a lot of situations where you need to have continuity in lab testing. There are a lot of situations we need to do diagnostic testing outside of a clinical setting. Genomics, population health programs, decentralized clinical trial is a perfect of that, patient recruitment across multiple states. And then there are also a lot of situations where you can do self-collect at home, right? Where you can ship out these boxes, employee screening programs, drug screening programs. And that's where we live, right? That's what we simplify. We had done 11 large-scale programs prior to COVID. And when COVID happened, we had everything in place to power COVID testing. So it was sort of a side effect. And we started power COVID testing. And for COVID, we've done, 1,100 programs, millions of tests.
Amazing.
And so forth, right?
Yeah, that's impressive. Well, and I think, as someone who's waited at a lab to get a test done, I love the at-home model. So I love that you're pushing that forward. What would you say is like the big vision for the company, and where are you planning to take all of this?
Yeah, so the big vision of the company is moving the lab testing prior to the physician visit. There's a concept that we internally talk about called pre-patient. If you haven't become sick yet, we consider you as pre-patient, right, in a value-based healthcare. The terminology is basically value-based healthcare by zoomed in on one single individual. Now, how do we make sure that we keep that individual healthy? Well, we need to monitor, or that individual need to monitor themselves, making sure that their levels are not moving in the wrong direction, and if they are, doing lifestyle changes much, much earlier, right? I normally do the car analogy. If you have a car dashboard, you see the values all the time and you know when to, increase the tire pressure, as an example. We don't have that dashboard, right? We have pain, which is, go to the doctor and make sure that the mechanics fixes you. How can we prevent it? How can we bring lab testing and make it a key component of preventive healthcare? And that is sort of a vision of the company.
Yeah, that's an interesting one. I've called it treating a healthy patient, because I only go to the doctor when I have something to complain about.
Yeah.
Like, how about keeping me healthy, because I feel healthy, right? So that's an interesting way to look at it.
Yeah, and it's interesting because I talked to one of the investors yesterday, I think, and he was like, well, the money is in the sick care. And I'm like, yes, I know, and that is exactly what the problem is. The money is in the sick care. Well, if you could manage to maintain a relationship, educate the relationship, allow them to know about their value in a preventative care before they become sick, you're also supporting the other side. You're supporting healthy patient going into the doctor's office. You're supporting what we call physician fatigue, right? They have more time to take care of the sick patients now.
Yeah.
And that's sort of a little bit of the vision, as I mentioned.
No, it's a beautiful vision, and to your point, we think we're healthy, but once you do the lab test, you realize, oh no, you may be at risk for diabetes or pre-diabetic or all sorts of other things that you could discover earlier because you are sick, but you just feel fine. So that's really, really a fascinating vision.
Yeah, and it always comes back to only if we knew,
Exactly.
right? How early could we have prevented?
Well, and you're providing the data. So thanks so much for sharing your story. Where can people go to learn more about ixlayer?
So ixlayer.com is the best place to go, and please reach out to us if there is anything and we can help you set up a full demo. It's very easy for us to spin up a new program. The other thing that I want sort of the audience to know is we are the tool and we provide this infrastructure. It is up to the health provider, the biopharma, the payers to utilize this tool. Without them utilizing it, it's just a tool in the tool stack, right? So hopefully they see the value and then utilizing this tool.
Well, it's powerful. I mean, everything's pushing to the home, and it looks like you're helping a lot of organizations do that. So thanks so much for sharing, and thanks everyone for watching. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, Pouria.
Thanks so much.